Hi, this is Dr. Cordy. I'd like to talk a little bit today about the 4 different types of PCOS and how we handle each one of those individually. Because they're handled a little bit differently. Fundamentally, we need to always foundationally nourish the body and repair the organs and tissues that are making these hormones. And the tissues and organs that have gotten imbalanced or sort of broken over time, we need to repair all of those. But each individual kind of PCOS can be handled a little bit differently. And it's good to understand the different kinds of PCOS there are, just to understand mostly where it's coming from and how we look at this on lab work, and then how we can follow up with this with supplements, with diet and lifestyle and behavior changes, and with other natural things that can allow us to heal the underlying condition that's creating the PCOS in the first place. So polycystic ovarian syndrome can be one of 4 types of PCOS. The first is insulin resistance, which is far and away the most common. Probably 70% and likely closer to 80% of patients with PCOS have insulin resistance. Sometimes we refer to this as metabolic syndrome, but the bottom line is there's a sugar handling problem that's creating and manifesting in physical changes in the body. One of those changes can be a change in the waist to hip ratio. Our waist should be smaller than our hips, and that ratio, when it gets higher, so when the ratio gets closer to 1:1 or even more than 1:1, so our waist is actually larger than our hips, we know that there's probably starting to develop some kind of an insulin resistance situation, and that's one way to measure that. In blood work or labs, I like to look at fasting glucose or fasting blood sugar. I like that number in the low 80s. I also like to look at insulin and fasting insulin, and I like that number around 5, not more than 8. If we start to see that number creep above 8, we probably are starting to look at some insulin resistance in the system, and some types of metabolic syndrome starting to happen. I've certainly seen that number in the 20s and 30s and 40s with lots of different kinds of patients, but especially my PCOS patients, when they start care, they'll have really high numbers of fasting insulin. Fasting insulin is a measurement of how well the body is handling blood sugar. And it's one of the very important ones, because it means when we take away food from you, when we fast you, and then we take your blood somewhere between 12 and 18 hours later, if your body still has a lot of insulin in the bloodstream, there's a resistance happening. There's a reason why that insulin isn't letting glucose into your body's cells and going away and doing its job properly. And so we need to understand why that's happening. That's one of the markers. And then the other marker is the triglyceride to HDL ratio. So triglycerides are fat particles in the bloodstream, and when we take that number, which I like less than 100 for sure, but let's say that number is 100, and then we divide that by HDL, and that's the good cholesterol that floats around and really cleans things up. It's anti-inflammatory in nature. And let's say that number I like above 45. And so if that number is less than 2.5 is what we're aiming for people. But we'd like to get that. Again, if the triglycerides are 100, the HDL is 45, that's about a ratio of 2.2, and that's a nice number. So we want to get those numbers closer together, and generally when those numbers are closer together, the body is healthier and more balanced in terms of its insulin resistance. And so there's a few different blood markers that we look at for insulin resistance in anyone, but specifically when it shows up with PCOS, we want to look at those markers and make sure over time those markers are getting better as we handle the underlying dysfunction of the system and the tissue. I'm going to follow up in a few other videos about the other kinds of PCOS types, both the adrenal and the post-birth control pill and the inflammatory PCOS. Thank you. I hope this helps.